Hi, welcome to this unique hair care initiative by IFCA. I'm Mona Sharma, and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory and it makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a sign of middle-age problem when you used to lose hair or have thinning of hair or bald patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems occurring even at a younger age. It is not uncommon now to see 25 to 35 years old people complaining about hair problems. Most of these problems, if identified early, can be managed well, and much of the hair loss can be avoided and can be managed by managing to modify our faulty lifestyle. Today, we have with us Dr. Arun Kumar, is a well-known doctor who specializes in dermatologist. He is MBBS and MD in dermatology, venerology, and leprosy. He is currently working as dermatologist, trichologist, and hair transplant surgeon at Skin Shine Clinic and Hair Transplant Center, Kashipur, Uttarakhand. Dr. Arun Kumar has dedicated his career to diagnosing and treating a wide range of skin and hair condition while providing a personalized healthcare services to his patient. He takes time to listen to his patient and develop a treatment plan that meets their individual requirement. Dr. Arun Kumar is aware of the need for the patient awareness and education about hair care and has spent a lot of time in giving talks at various platforms across the country. Thank you, Dr. Arun Kumar, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to the show.
Really thanks to you for giving me this opportunity to aware and increase the knowledge of common masses about hair care in day-to-day life.
डॉक्टर हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया. So doctor, today we are going to discuss the hair care in current scenario. So whenever we talk about hair care in current scenario, the first and the foremost common problem faced by all of us, irrespective of gender or age, is hair loss. So is hair fall normal, doctor?
Yeah, hair fall is normal. In day-to-day life, we can see there are approximately 1 lakh to 2 lakh hairs in our scalp in a normal situation. Out of those, approximately 100 up to 100 hairs usually fall daily. In common terms, I'll say ये बहुत नॉर्मल है, बहुत ही नॉर्मल है कि एक आम व्यक्ति के बाल गिरे, क्योंकि जब तक पुराने बाल नहीं गिरेंगे नए बालों की ग्रोथ नहीं होगी. जैसे पुराने बाल गिरते रहते हैं वैसे ही नए नए बाल आते रहते हैं. तो हमें एक नॉर्मल हेयर फॉल और एक हेयर फॉल, एक्सेसिव हेयर फॉल की कंडीशंस को डिफरेंशिएट करना आना चाहिए.
सो डॉक्टर जैसे कि आपने बताया कि डिफरेंशिएट करना आना चाहिए, तो मतलब इज देयर एनी अलार्म साइन और समथिंग दैट इतना लॉस होगा तो हमें डॉक्टर को जाना चाहिए?
In practical terms, we say that if you are having hair fall more than 100 to 150 hairs per day, then we can say it is not normal. But we usually say patient coming to our clinic that doctor बहुत hair fall हो रहा है, and day to day उनकी वही complaints होती हैं. But as a dermatologist and trichologist, I need to differentiate. We do generally by hair pull test. We need to differentiate whether the hair fall is actually there or if it is just a normal hair fall. So in a normal condition, we can say up to 100 hair fall is as usual physiological. But if it goes beyond 150, then we need to be concerned. And normally people can't just calculate their hairs because it generally takes 24 hours. We need to calculate the whole day hair fall. It is not easily possible for all the patients to just collect and calculate hair fall. So they need to just come to their trichologist and consult about them.
Okay, doctor. So doctor, what are the causes of hair fall? कि hair fall होता क्यों है, किस लिए होता है, क्या causes हैं इसके?
There are multiple causes of hair fall, not single one. In males and females, there are different causes. Hair fall can be due to genetic predisposition, as we can see in androgenetic alopecia, which is both in males and females. There are vitamin and nutritional deficiencies. There are skin problems. There are hair growth disorders such as cicatricial and non-cicatricial hair alopecia are there. There are and hormonal problems in females which are responsible for it. There are certain diseases like uh, hypothyroidism and hyperthyroid, which are associated with hair fall. There are certain internal diseases, stress, which is a major factor in today's day-to-day life. So stress is one of the biggest factor nowadays. As patient is having stress, he got hair fall, and again it leads to stress, and then again hair fall. It is a vicious cycle. And certain cosmetic factors in females, childbirth, pregnancy, it is also responsible. And nowadays, as we are having more and more uh, carcinomas, so chemotherapy is one of the drugs which is mainly responsible for hair fall. So not a single cause. There are multitudes of factors which are responsible for our hair fall.
Okay, doctor. So now that we know the causes, doctor, one more question comes up to our mind is nowadays every one of us is like having a sedentary lifestyle, like working late hours, not sleeping, eating anything and at any time. So can a person lifestyle play a role in hair fall?
Yeah, exactly. If a person lifestyle is sedentary and he's not having a good, healthy, regular lifestyle, as he's not taking proper diet, he's not proper working, making workouts, and he's not having proper nutrition, is not concerned about the nutrition deficiency he or she is having, then these things can lead to hair fall. And nowadays, as more and more people are living in cities and having stressful life due to their jobs, due to their families, due to their relationship and their responsibilities, so stress is one of the factors. So we need to balance a healthy lifestyle with a healthy living being. So which can make your hair also healthy.
Okay, doctor. So doctor, now that हमें पता चल गया कि हेयर फॉल कब नॉर्मल है, कब अलार्म साइन है, तो एक क्वेश्चन और आता है दिमाग में कि व्हाट आर द मेडिकल ट्रीटमेंट ऑप्शंस अवेलेबल फॉर हेयर फॉल, लाइक टॉपिकल है, सर्जिकल है, या फिर ओरल है, या नॉन सर्जिकल भी है?
There are multiple treatment methods based on the type of hair fall you are having. So there are topical treatments which are available. Minoxidil is a well-known topical agent which most of the people are using. But first of all, we need to differentiate whether the patient, he or she, really needs it or not. And there are oral treatments such as nutraceuticals, which are widely used. There are certain drugs, finasteride, dutasteride. So before jumping onto the treatment, we first need to differentiate whether the hair fall or alopecia is cicatricial or non-cicatricial, whether we need topical, oral, or nutraceutical. So these things first to be differentiated and diagnosed, then only we can jump onto the treatment. So treatment part, we are having oral, topical, and multiple. And when in particularly males, when we are not getting absolute better result with the oral and topical, and there is excessive hair fall, and there is huge area which needs to be covered. Then nowadays we are having very wonderful hair transplant surgeons in our country, which can give you a better coverage and growth over the scalp. So there are multiple modes of treatment depending upon the stages of hair fall and the needs of the patient.
Okay, so doctor, wide varieties of treatments are available. We just need to consult the doctor and get the right treatment.
Yeah.
So doctor, there is one another word called nutraceutical, which is getting a lot of focus these days. So what is nutraceutical and what is the role of nutraceuticals in hair health?
As I said, nutrients and vitamins play a major role in our human body. Same happens with our hair, nails, and skin. Nutraceuticals are certain combinations of nutrients and vitamins which are preferably available in pharmacological made by pharmacological companies for to fulfill the deficiencies or RDA requirement of an individual. Since all the nutrients are not easily available in a diet. Suppose in a vegetarian diet, which is deficient of biotin and vitamin B12. So these need to be supplemented via the nutraceuticals. So nutraceuticals play a very good role. Certain individuals, particularly in Indian scenario, females, महिलाएं जिनमें आयरन डेफिशिएंसी होती है, it is widely known that in India we provide iron supplements to the pregnant female because in Indian scenario most of the females are iron deficient. So these are what are these? These are just nutraceuticals. These are the supplements we need, but we need to differentiate when we can use it and who needs it. So nutraceuticals they definitely have a role in maintaining hair growth and treating the hair fall.
Okay, doctor. So, doctor, like in nutraceuticals, as you said, there are a lot of vitamins and minerals. So, can you please enlighten us, like, what are some of the vitamins used in management of hair fall, or you can say alopecia?
There are vitamins. The most important vitamins required in hair fall are vitamin A, which activate follicle stem cells, and vitamin B, B7, biotin, which is helps in cell signaling and helps the growth of the hair follicle. Vitamin B12, not only here, it is required in other skin disorders and skin conditions. Iron, which is usually because iron is required for hemoglobin production, and hemoglobin is responsible for the oxygen transport in the body. So iron is one of the major micronutrients. Similarly, zinc. Zinc is also one of the major micronutrients which is required by the body. Uh, Similarly, selenium, copper. There are multiple micronutrients which are required by body, and these are the few names which I have mentioned. These are required for our hairs.
Okay, doctor. So, like you said, multiple minerals like zinc, copper. So, do they really promote hair growth?
They not directly they promote the hair growth. As I said, हमें पहले ये देखना होगा किस पेशेंट्स को क्या रिक्वायरमेंट है ना. There are certain tests available. We can if a patient is coming for a hair fall, we just need to first of all evaluate whether he or she is having the excessive hair fall or not. If he or she is having excessive hair fall, then we should look for her iron profile, vitamin B12, her other conditions, thyroid profile. So after examining these, we can go for the nutraceutical. Then only we can prescribe those nutraceuticals.
Okay, doctor. So, doctor, like, is there like now that we know that what are vitamins, minerals, and nutraceutical, so is it required to take these nutrients as per gender RDA requirement, or we can take them as blindly? Like there are so many things are available online, we can just buy it and take it by ourselves.
No. Gender RDA is required because the requirements of a male and female are different. पुरुषों में और महिलाओं में उनकी शारीरिक जो संरचना होती है, उनकी जो बॉडी फिजियोलॉजी होती है वो डिफरेंट होती है. ठीक है, बॉडी फिजियोलॉजी डिफरेंट होने की वजह से उनकी दोनों की रिक्वायरमेंट अलग है. बिकॉज फीमेल्स गो थ्रू so much things like pregnancy, menses, so their requirement of iron is more than the males. Similarly, in kids, the requirement is different than the adults because they are growing children, they need calcium. Similarly, females in pregnancy, they need calcium. They have more chances of osteoporosis, so they need calcium. In comparison to males, they require the RDA is few micronutrients is more. Contrary, males are in previous times also it is considered that males require more calories as compared to female because of their bigger body size and bigger weight. So the RDA requirement is different in females and males. So we need to consider these factors before blindly taking nutraceuticals.
Uh, Doctor, like previously also you said that stress is important. So can you enlighten, like thoda और जानकारी मिल सकती है, like what is the impact of stress on our hair health?
Actually, stress nowadays is a major factor because in day-to-day and increasing nuclear families, we are going through a lot of stresses in our families, in our relationship, in our life. There is work stress, there is family stress. A lot of things are there. But what does stress do? Stress generally increases the level of cortisol in your body, you know, which in turn helps in breaking down your major amino acids, such as hyaluronic acids and other major micronutrients in your body. So, in turn, what it does, it affects the growth of your hair. So, if the growth of your hair is affected, your hair falls, and hair fall gives you more stress. Then that stress combines with the previous one, it increases more hair. So it becomes a vicious cycle. Hair fall stress, then hair fall, adding to more stress, then hair fall. So it is a vicious cycle. तो हमें स्ट्रेस को ट्रीट करना बहुत जरूरी है. Whenever a patient comes to me, I usually ask when he or she says that मेरे बाल गिर रहे हैं, तो फर्स्ट ऑफ ऑल आज कितने दिन से गिर रहे हैं, कोई सब कुछ ठीक है फैमिली में. If all the other factors are okay, her blood profiles are normal, her vitamins are normal, then stress is need to be rolled out. Because if a patient is physically and mentally healthy, then only he or she can have healthy hairs.
Okay, doctor. So, doctor, like आजकल stress तो ऐसा है कि we cannot avoid it. So whenever we
Yeah.
are at home, हमारी मम्मियाँ कहती है कि ऑयल से चम्पी कर लो, स्ट्रेस चला जाएगा और बाल भी बहुत लंबे और घने और सुंदर हो जाएंगे. So doctor, what do you think? Oiling hair is a ban or a boon?
I won't say it is a ban, a boon. It is a midway between. If you say champi kar lo and it will relax you, definitely it will relax you because massaging your scalp and your head will definitely relax you. It will help in reducing stress. Then it will help in your hair growth. But oil per se is not required in your body to improve the hair growth because our scalp is already secreting so much of sebum and sebaceous oil content that we don't require oil to improve the hair growth. But as you said, chumpy, then I'll say it is fine, it is good.
Okay, means oiling hair does not promote hair growth. It is only for relaxation purpose.
Yeah, totally.
Okay, doctor. So, doctor, can you give us some important tips for healthy hair?
For your healthy hair, I'll give you the important is that maintain your healthy lifestyle, have proper adequate diet containing protein and all the nutrients. If you are a vegetarian, please take vitamin B12 supplements if possible as much as you can, and just and care your hair with mild shampoo. And if you are having dandruff and other hair fall diseases, then please consult your trichologist as soon as possible.
डॉक्टर. सो डॉक्टर, लाइक एक और बहुत बड़ा सवाल है इंडियन पॉपुलेशन के लिए, वो ये है कि उन्हें पता ही नहीं है कि हमें जब बालों की प्रॉब्लम होती है तो हमें कहाँ जाना चाहिए. ऐसे ही मतलब लाइक कहीं पे भी वॉल पे पढ़ लेंगे और वहाँ पे जाके ट्रीटमेंट करा लेंगे. सो कैन यू नो लेट आवर व्यूअर्स नो अबाउट टुडे लाइक whom to concern for the hair problems?
या ये एक बहुत बड़ी समस्या है बिकॉज इन अ डेवलपिंग नेशन वी आर हैविंग स्कैर्सिटी ऑफ डॉक्टर्स at all the places, and particularly specialist doctors such as dermatologists, which are MD and DVL. They are very few from the last few years. There are very few people, and so I'll suggest if you are having your hair problems, skin problems, and anything concerning your face and hair, please consult a certified dermatologist or trichologist with who has a good hand in clinical hand and who has completed his MBBS MD and MBBS DVL from a reputed institution. You just need to look at the as his qualification first, what he or she has done, because nowadays there is things that so many people just write down skin treatment in their board since they haven't done they haven't got any specialization in dermatology, but they are writing, and the treatment they provide is such a ludicrous one and such a funny one that I can't mention here, and they just play with the health, skin and hair health of the patient.
Okay, doctor. So, doctor, also one more question is that one like there are so many products available online. So, are they really useful?
Mm, I'm not sure because there are so many lotions, so many oils. They are available on online. It is basically there is one thing in dermatology. We have our scientific studies. We have proven results. Then only we apply those treatment and those medication to the patients. But all the things available online, they don't have any studies. They have they don't have any safety profile. कुछ नहीं है, बस उन्होंने अपना एक प्रोडक्ट बनाया, एक अच्छी खासी मार्केटिंग गिमिक है. they these things only play on the marketing gimmicks. Few years back there was one lotion which was promoted by a reputed company, and it it was sold very well because a reputed company advertised in that way. एक अच्छी कंपनी ने उसका एडवर्टाइजमेंट किया, वो बहुत अच्छा बिका, बट हुआ क्या, पेशेंट को कोई रेस्पॉन्स नहीं आया, कोई किसी ने कोई क्लेम नहीं किया. ऐसी डे टू डे वी आर सीइंग दैट मल्टीट्यूड्स ऑफ कंपनीज आर कमिंग एंड सेलिंग प्रोडक्ट्स, बट अल्टीमेटली होता क्या है, पेशेंट फ्रस्ट्रेट होता है, ठीक नहीं होता है, तो एट लास्ट हमारे पास आता ही है. आई हैव सीन मैनी पेशेंट्स who are taking treatment online, just consulting many online applications and all that, but when they haven't got any results, they are ultimately coming to the dermatologist, and it is necessary that you must visit your dermatologist and discuss your problem, because your dermatologist or trichologist only after examining you and looking at your condition can prescribe the treatment. Nothing is just go online and apply this product and that product. It will only harm you and nothing else.
Okay, doctor. This discussion was very informative. I'm sure our viewers would be benefited by it. So, doctor, can we take some questions from our live audience?
Yeah, sure.
Okay, the first question from our live audience is, sir, social media पे आजकल बहुत सारे hair care product है, क्या उनका direct use without any medical guidance सही है? ऐसे product क्या hair के लिए helpful है? उसने
हेयर के लिए हार्मफुल है या हेयरफुल है?
helpful.
As I said, there is no such studies. मतलब कुछ हम पता नहीं ना उसमें क्या है, वो उन प्रोडक्ट्स के अंदर कंटेंट क्या है. पेशेंट्स मेरे पास आते हैं, बोलते हैं कि सर हम ये सनस्क्रीन यूज कर रहे हैं, ये हम लोग ये फेस वॉश यूज कर रहे हैं. आई जस्ट आस्क देम व्हाट आर द कंटेंट्स इन इट. दे नेवर न्यू. उनको पता ही नहीं होता उसके अंदर क्या कंटेंट है. ऑब्वियसली पेशेंट को नहीं पता होगा. मैं उनसे कहता हूँ आप मुझे एक बार दिखाइए, मैं उसको अंदर देखूं कंटेंट क्या है. इफ इज इट यूजफुल देन आई कैन से कि हाँ ये ठीक है. बिकॉज इतनी सारी चीजें हैं ऑनलाइन, उन सबका ट्रैक रख पाना उसमें क्या कंटेंट है, इट इज जस्ट इम्पॉसिबल. Daily new companies are coming, they are promoting with so much glamorous ads and such a beautiful advertising gimmick they are giving. So they are just with lucrative options, they are just attracting people and nothing else, and they could only be beneficial if they usually contain those contents and those compositions which is required your hair. So I don't advise to just go blindly over the online. You first need to consult a certified dermatologist whether you whether you need it or not, whether it is nutraceutical, whether it is topical, whether it is oral. It first need to be evaluated by your trichologist, then only can be taken.
Okay, doctor. Another question from our audience is, डॉक्टर मेरी फैमिली में सबको हेयर लॉस इशू है, क्या मुझे भी ऐसा कोई प्रिकॉशन लेना चाहिए? क्योंकि मेरे मम्मी पापा को भी, मेरी दादा दादी को भी था। मेरी एज अभी सिर्फ 18 है और मैं कॉलेज जाता हूँ और मैं एक मेल हूँ।
If your family has a history, then you are likely to have tendency of hair fall, but it is not absolutely correct all the time. But you need to be concerned for your hair and look for your excessive hair fall. As I said, you must differentiate hair fall from excessive hair fall. So he need to be vigilant and nothing else. He just maintain his proper diet and healthy lifestyle and just need to be vigilant whether he is having excessive hair fall and a receding hairline. In males, receding hairline is the first symptom of progressive baldness. So he must be vigilant about it. If he is experiencing any of these things like excessive hair fall, a receding hairline, then he must consult his trichologist and need not to take any stress for it, because stress will only increase his hair fall.
Okay, doctor. So doctor, like ये जो फैमिली में जब सबको ही हेयर फॉल होता है, तो क्या ये जेनेटिक भी हो सकता है हेयर फॉल?
जेनेटिक होता है, बिल्कुल होता है, बट समटाइम्स इट स्किप्स जनरेशन, बिकॉज इट्स नॉट ऑलवेज दैट father had a hair fall, then son will have. It's not always mandatory. Sometimes it skips generation. We have seen that father don't have a hair fall. Father is having a perfect scalp with full hairs, and we see hair fall and androgenetic alopecia in son, because it is a condition which can skip generation.
Okay. Okay, doctor. Another question from our audience is, डॉक्टर मुझे बहुत ज्यादा डैंड्रफ हो रहा है, उसके बाद से हेयर लॉस चालू हो गया, तो इज देयर एनी कनेक्शन बिटवीन डैंड्रफ एंड हेयर लॉस?
Yeah, definitely. Dandruff, what dandruff does? Dandruff uh, just it inflames the scalp and reduces the nutrient absorption from the scalp. So it ultimately leads to hair fall. So there is definitely a correlation between dandruff and hair fall. So he must first of all treat his dandruff. Dandruff को treat करना जरूरी है before going the treatment of hair fall. If the dandruff gets corrected, then with other topicals, his hair fall will easily be corrected.
Okay, doctor. Another question from our audience is, sir, my age is 35 and nowadays my number of gray hair is increasing day by day. Do I need to worry, or is it completely normal, and can I use hair color or something else? Because I heard that hair color can worsen the hair condition.
Graying of hair after the age of 25 is quite normal nowadays. As I said, stress and the lifestyle of the patients nowadays is such that we can have gray hairs after the age of 20 and 25. And in this case, his age is 35. So it is perfectly normal that he's having gray hair. If he's not concerned about the cosmetic appearance of the hair, then he can leave it like that. But if he is concerned about the cosmetic appearance of it, he can go with the hair dye, which can be applied and which can be easily used for masking of the gray hairs over the scalp. It can be easily applied, but he should be concerned about the quality and the allergic potential of the hair dye, because hair dyes usually contain PPDs, which can easily cause allergic dermatitis, contact dermatitis. So if he is not having those issues, he can perfectly go with the hair dyes.
Okay, doctor. Another question from our audience is, doctor, during my pregnancy, before pregnancy, there was no hair loss, but after pregnancy, I'm experiencing a heavy hair loss. So why I'm getting so much of hair loss? Is there any deficiency in me?
No. You see, as I said, females go through a lot of physiological changes in their body. Pregnancy is a condition in which there are a lot of changes, hormonal and physiological and physical changes in our body. In pregnancy, there is reduced hair loss because of the hormonal condition in the pregnancy. And hair goes into anagen phase. After pregnancy, there is a condition known as anagen effluvium. So the most of the hairs which are not falling during the pregnancy, they suddenly start falling after the delivery. So it is just normal and physiological. She should not be so much worried about hair fall, but she can easily consult a nearby trichologist regarding it. It's normally a normal condition and it's physiological.
And it can be managed.
Yeah, it can easily be managed. It can easily manage. Yeah.
Okay, doctor. So I quickly take the last question because we are running out of time. So last question is all females wants to know. So doctor, this viewer is asking, doctor, I want to do hair heat treatment to get a straight hair. Can I do it? I heard that this can lead to hair fall. So is it true?
Skin heat, sorry, heat treatment.
हाँ बालों को हेयर ट्रीट करते हैं लड़कियां.
Actually, as most of the books I have read and most of the articles I have read, and in my experience, the heat treatment it just damages hairs. And I have got many patients which comes to me with excess hair fall after that. So most of the females they just want a good hair and want to straighten their hair. It's a female, it's a person to person choices in female. But being a trichologist, I should not advise to go for these things because it breaks the keratin bondages inside the hair and leads to breakage of the hair.
Okay, doctor. Doctor, would
Sorry
you
to
like
disappoint all the females there?
Yes. So, doctor, would you like to give a take-home message or any other suggestion to our viewers today?
So, take-home message is that maintain your healthy lifestyle, have your proper nutrient diet, rich in all the macronutrients. And if you are having excessive hair fall, please consult a trichologist or dermatologist and don't just go online searching for useless products. That's it.
Thank you so much, doctor, for sharing so much of information and all your expertise with us today and answering all the questions for our viewers today. I'm sure our viewers have found this session very helpful. Thank you, doctor. It was a delight to have you, and thank you so much for your valuable time.
Thank you. Thank you.
Thank you, ladies and gentlemen, for joining us today. This is Mona Sharma, your host, signing off for today. Thank you, doctor. Bye-bye.